As the pandemic continues, data shows that nearly a third of all COVID-19 deaths in Indiana have occurred at long-term care facilities. Now state officials are making changes to how staff at these facilities handle reporting of the virus. Demetrius Sanders joins us now to tell us how a new set of guidelines may keep long-term care residents and families more informed. Demetrius.
Mike, in early April, Indiana Health Commissioner Dr. Christina Bach signed an order allowing the transfer of residents at long-term care facilities. Now, less than a month later, more changes are coming to protect those that are most at risk. Recent data from state of Indiana officials show that 1,467 confirmed cases of COVID-19 have happened at long-term care facilities. Of these confirmed cases, 260 resulted in death, making up 32% of the total COVID-19 deaths in the state.
To date, nearly 1/3 of the folks in the state who have died were residents in long-term care facilities, which again illustrates the incredible vulnerability of our elderly community.
Monday, state officials announced new guidelines for long-term care facilities.
I know how important it is for folks and the interest around knowing what's going on in a long-term care facility, particularly for people who have a loved one that lives or resides there.
One of the guidelines issued by the state will require long-term care facilities or nursing homes to designate staff that provides daily updates to family members and residents.
It's to inform both the residents and their designated representatives of the total number of COVID-19 cases and deaths, as well as actions that they've taken to prevent the spread of this illness.
The state will also provide an update each Monday as the outbreak continues. Rusniak says it may take some time for these guidelines to be fully implemented, but he says the information that they will provide is critical.
This has been a very collaborative process with a lot of thought and a lot of input, and we recognize that it's a new approach and that it's going to take some time to implement. But I do want to emphasize how important this is.
Now, Rusniak says there is not a separate breakdown for cases involving staff at long-term care facilities due to some staff working at multiple locations. He also says if a family or resident feels they are not being properly updated, they may contact the state by email for an investigation. And we'll have a link for this resource on our website, mywabashvalley.com. Mike.